Hello, hello, hello. Welcome back to this episode of YNA You're Not Alone. I'm joined here today with my co host Sina,
What's up?
Will,
How's it going?
and Cheyenne.
Hello. So today's topic is on medication, and this format is going to be a little bit different for today. We have a pre-recorded interview with a doctor that we know. So I'm gonna play his introduction, and we're going to be reiterating questions that we asked him during the interview, and we're just going to be having a conversation afterwards. So
Hello. Welcome back to YNA You're Not Alone. Today's topic is going to be on medications. My name is Dr. Armin Tadayyon. I'm currently a first year anesthesiology resident at the University at Buffalo in New York.
okay, so that's a little intro on our guest.
And so the first question that we ask Dr. Tadayyon is, so in your experience, especially through the medical field, it feels as if medication is a very touchy topic. It's something that a lot of people either are very against or very for. Then there's the middle, which is a bunch of people who don't really know which side they're for and don't have the information for. So I asked Dr. Armin Tadayyon, in your experience in the medical field, have you ever had a client, patient, or whoever split between the three types?
Absolutely. We see that all the time. One of the biggest things right now that kind of creates this disparity is the COVID vaccine, right? That's a certain type of medication. It's a vaccine, but it's something that you put in. It's a synthetic drug that you put into your body to have therapeutic effects, right? So you have people who are completely for it, and people who are completely against it, and you also have people that, hey, I don't know where to really stand. What are the facts? Another one, pertaining to this channel, are the use of psychiatric medications. Some people may see, for example, being on SSRIs or SNRIs for depression and anxiety as a stigma, and they don't really want to be on that. Or, for example, other people come in and they have been dealing with depression for a significant amount of time. It's to the point where they feel debilitated throughout their day-to-day life. And what they're asking for is medication. They're looking for that one pill to fix it. They don't want to sit through therapy. They don't want to, do that. They're looking just for a pill that will be the answer. So there's really a big disparity there between, the people who are wanting to jump into, hey, I want to find that magic pill versus, hey, I don't know what this is. What's getting put in my body? I'm kind of wary about this.
So I really believe in trying to understand medication. It's the first step of trying to understand your body and how you grew up and how medication has been implanted into your life. Whether you did take Advil as a kid or whether your parents did give you some sort of medication to help you when you were feeling sick. But I think with mental health, it's kind of a little bit different because it's all the chemical imbalances in your brain and which side you want to go on, whether you want to get therapy or whether you just want the answer resolved. And Will here has his own experience with medication. So, Will, were you ever in that kind of situation where you were more on the left or more on the right or more in the middle? And how did you respond to like going onto the side that you did?
Yeah, for me, I've had a lot of experience with like trying different medications. I had always been kind of open to, I would say, in his words, how he put it is he described it either as like, hey, you're kind of against it, you don't know what it's going to do, or like you're kind of on like, okay, I'm trying to find this magic pill to like solve the problems. And that's kind of the side that I would lean more to is I thought I was open to the experience of, trying to figure out how these medications can help me. Uh, Pretty much the entire time. So it was easy for me to like go see somebody, and not even that part wasn't that hard. I've always been open to just trying to understand like, hey, what's going on? Maybe it is like a chemical imbalance, and these medications could help me. And I know I do know people who they don't even take Advil, so I can understand that other side as well. But for me, I've always been kind of like on that open concept of like, hey, this could help me, maybe not. What's the worst case? I try it, it doesn't work, I don't take it.
Yeah, and I think that's the most important factor of the whole thing is you asking the right questions on whether you want to take the medication that's prescribed to you or not. And honestly, you kind of look at the results of other people, right? Like you see, hey, that person has taken this medication and it's helped them a lot. And I've also seen other people who've taken the medication who it might not help them a lot, and they've had to test different types of medication until they get to the right one. And we're stuck. I think the reason why it's so touchy is because that both sides are so to the extreme that some are like the medication is what you need, and some are like the medication is not what you need, and you can find holistic views, or you can find different herbal medicines that can help you. It's not all about medication. And it shouldn't really be like that. We shouldn't really have this difficulty on what side we have. It's more of trying to understand what you want for your body and what you believe that through your experiences and through someone who is an expert in the field of medication believes that's the best for you. And in the end, you need to understand that the information and the facts that are presented to you are the information and the facts that they have. So you need to figure out whether you want to accept those facts or information, and if you want to test whether this medication will help you in the end.
Yeah, also just to quickly add, when I began my experience with medication, it always, the reason I think is that people are kind of afraid of it is the medication aspect, but they never, experts will never push medicine on you. They
Right.
will, unless you are, you have severe mental problems, and that's okay. But for me, it's just started out with talking to somebody, and they suggested it at first, and I didn't do it at first. I was like, this is helping, like trying to get to the core root of these problems, right? But over time it evolved into, okay, let's try medication. Like, they will, if you go see an expert, they will usually start with, hey, you're just going to talk to them. They're not going to say like, oh, right off the bat, here, take this, like it'll sedate you. Like, that's not
Yeah.
how it goes.
Yeah. And the next question that we asked Dr. Tadayyon is, why do some people believe that medication they are prescribed or the magic pill isn't the answer to their problems? I know there's a lot of people out there who are still very worried about getting medication prescribed, going down the trend of fear in the health world of what doctors are prescribing. Do people really have this fear, and why not just take the medication to really answer the fear that they're having?
I think the first problem that comes in, I don't think it's much of a fear, but yeah, or I don't know what I'm putting in my body. I think when it comes to psychotropic medications, for example, like antidepressants, we have tons and tons of years, over 50 years of data showing that this stuff is helpful, it's beneficial, and it's neuroprotective. It protects neurons. But I think one of the major, hesitations that people have to getting put on, especially psychiatric medications, would be compliance. I don't think the idea of taking the pill is as scary as I have to do this every day for who knows how long, possibly the rest of my life. And I think it comes into the point of, I don't want this medication to control me. I don't want this to be something that I'm doing every single day for the rest of my life or for the next 10 years, for example. So it's a major question. I think what the hesitation comes in is of compliance. A lot of patients, from what I've seen, like to take things PRN, as we like to say, as needed. And it doesn't really work like that with some, psychiatric medication like antidepressants. You need at least 2 weeks of antidepressant, of regular use on antidepressants for them to at least have some type of an effect. So I think the major fear is compliance. I don't want to be controlled by something. I don't want to take something for an extended period amount of time.
And where control comes in, I believe he makes a really good point because my father has to take lots of medication for his heart. And so I think the one thing he always complains about is, I have to go take my pill. I have to go take the next pill. I have to go and get them refilled. And I have to continue this life cycle because it keeps him alive. And so I do believe where Dr. Tadayon is saying that control plays a factor in how we look at medication. Brandon, do you feel as if control would be the issue, or do you believe there's like another issue why people won't take that magic pill?
I feel like why some people would not take that magic pill is mostly likely the side effects. Kind of like how you describe how like your dad has to take medications for a heart. I think I could kind of say like with my own mom. This was a while back. I want to say 5, maybe even 5 to 10 years ago. I remember my mom was working at the bank, and she fell down the stairs and she fractured her leg. But then the prescription or the pill that they put her on was a Xanax, just so it could help her with the pain and things like that. And at first she did take it and it did help, but the only thing she didn't like about that pill was that the side effects that it gave her basically made her feel like a zombie, as she always described to me. And like I could notice like on a daily basis how her mood always changed. Like she wasn't herself. When it's low key, that kind of scared me in a way because like I know how my mom is and how she's around the house. Like she's always up and going. Like she's always conversating things like that. I know how she is. But then just seeing like that slightest change from the very beginning when she first took that pill, and then weeks and weeks going by and have to take it, like it just completely changed her in a way. So I guess like things like that will make people not want to take the pill. And I mean, even for some people, like for example, if they were to take it and feel like 100 times better and things like that, and they feel happy, like I feel everybody is different with their body chemicals and things like that of how they react to the pill.
And when you see somebody change too after medication, you're kind of like, it kind of gives you that like, okay, I don't really want to take medication now for anything because I see what I'm seeing in another person kind of affects how I feel about it. And especially if you have someone who's going through life and death experiences with medication where it saves them and needs to keep them alive, you're kind of like, it's so hard, like
Yeah, I
because
could see that.
like 1 second you're so excited about like whoever it is to stay alive because of the medication, but you see them change too because it does change the chemical imbalance in their brains. So with your experience with medication, Will, I know that you went through this whole beginning process of the magic pill being the answer. Was the magic pill the answer?
I mean, it takes a long time. Like, yeah, a lot of the medications I so it through my experience, I have been on medications like that where it was like very mind suppressive, and that's fine. Like some people like need that, and that's okay. But I didn't like that, and that's all it took for me to say. Like I said, like this is not the one. I don't like that. There are thousands of medications to try. And they will just try something new. If and they were very receptive. You can talk to them for 30, 45 minutes if you want to, and they will say like, we'll get down to the core root of like what the issue is, and try a different medication. For me, on this like controlling factor, it wasn't just like I never really thought like, okay, like like if I didn't like the medicine, I just didn't take it. I tried a new one. Like it was fine, and it was just the process of finding them. With a lot of those medications, it just takes like usually what he said with like SSRIs, they need to be in your system for a certain amount of time. Usually, like a baseline, I would say a good 2 weeks before you like will start seeing the effects or the benefits, the downsides, like anything like that. It just needs to build up in your system. And so like how I would schedule like appointments is it would be on a monthly basis because that first 2 weeks is a build up, and the 2 weeks after that you're really experiencing how this medication works. And for me on the controlling side, it was just like it took me years to find the correct medication that I felt suited me. And through that experience, like comes with like, so sometimes they would send over a pill that wasn't on my insurance, and it would be hundreds and hundreds of dollars. And all they needed to do was just change like it. Like they have a bunch of off-brand stuff too. They could have just said, "Oh, send this; it'll be like $4."
Yeah.
But like they don't know that, like they just send the medication. So like there's other issues internally like that where like, oh, you have to call them back and say like, that's too expensive. Like try a different one. Sometimes it's like I said, it's just the wrong medication for you, and you'll call them and you'll just stop. But like you still have that appointment set up maybe 3 weeks from now, and you have to wait to go see them again to try something new. So it's a trial and error. It's a process of trial and error. But honestly, like where I'm at now is the benefits outweigh all the negatives that I've gone through with it. Like I have the medicine that I like, that makes me feel as much me as possible, and that journey is worth it.
And I totally agree with you on that.
So the next question that we asked him is medication a last resort, or is it usually the first step in making a decision whether medication is right for you or not?
That's a great question. I think the answer to that question depends on the person. For example, if somebody, let's say we create, let's say hypothetically, somebody's dealing with a significant amount of depression throughout their life, they have the inability to really construct the future. They have difficulty finding joy in their life. So, what would be the first step for them? Well, what would they be comfortable with? If we're making major steps towards changing your perspective on life, changing your outlook on life, you have to be comfortable taking those first steps. So some people might be comfortable with starting, medication, starting an SSRI, daily, and then checking in with their psychiatrist in 30 days from now. Other people might be a little bit hesitant on starting a new medication, but they might be open to the idea of cognitive behavioral therapy. And that might be the best bet for them. So really, what really matters most is what is most comfortable for the patient and what the patient feels is going to be the best step for them. So some might start out with medications, some might start out with cognitive behavioral therapy, and then they can be adjuncted. For example, if somebody participates in CBT but doesn't find that much relief and wants to add more, then what they could add on is medications. Or if somebody starts on with medications, doesn't seem that much relief, what we could add on is CBT.
So, for the listener and viewer, I want to explain to you what CBT really quick is. Therapists, they go through different theories, and there's many different theories that they can go through. There's play therapy, there's DBT, dialectical behavior therapy, there's CBT, cognitive behavioral therapy, and EMDR, eye movement desensitization and reprocessing. There's many different theories, and many different therapists use many different theories, but the main one is CBT. And CBT pretty much is reframing your mind to think about things in a different light and a different opinion. So, not allowing yourself to stick onto one topic and telling yourself things. It's reframing the way that you see and the way that you maybe even see life. A lot of therapists enjoy CBT because a lot of clients achieve their goals in therapy with CBT. It's just a quick explanation on what CBT is. Um, in my experience in therapy and with the therapists I've conversated with, is CBT is extremely helpful. It's something that if you do want to go to therapy, I definitely recommend you talk to your therapist about what theories they go through and then researching those theories, because you want to make sure that sometimes some theories don't work. And every case scenario is different. And so we definitely recommend to the listener and viewer, do your research and maybe even ask your therapist what kind of theories they plan on going through or what they specialize in. Very important. But like he was saying, it's kind of we're in this medical world now where your opinion kind of goes into two different directions. Cheyenne, I know that you have not had the experience with medication, maybe not had the experience with CBT, but when you're in a decision making process, what do you think like helps the person benefit more? Do you think people like want to go towards medication? Do they want to go through to therapy? Is it difficult, would you say, if you were ever in that process to try to choose the route?
I think it really just matters on your upbringing and what type of medical practices your family uses, or whatever they do. Because I know on my mom's side, she likes very like holistic doctors and like Eastern medicine practices. So it really just depends on what you're comfortable with, what your family has introduced to you since birth, and I mean, I think really that's what factors in on the decision making when you want to decide whether or not you go to therapy, whether you take Western medicine, whether you take Eastern medicine, just whatever works for you.
Yeah, and I totally agree, especially when your environment and how you're raised kind of shapes about what kind of direction you'd rather go in, which is either go through and see a therapist. Because I do know in a lot of families, and I just want to mention, I saw this really funny tweet. It was about this woman who would say, "Oh, mom, I'm going to therapy," and the mom was very what's it called? The mom was not ever had heard of therapy, and whoever she spoke to about therapy was quote unquote crazy. And so she asked her daughter, like, "You're not crazy. Why are you going to therapy?" So in
That's
different,
severe end.
yeah, different
Wow.
international countries, we all look at therapy sometimes as this person needs a lot of help. And I think the issue with therapy is looking at many difficult disorders such as schizophrenia, multi-personality disorder, bipolar disorder, these disorders that are very like that have a lot of mental effect on the person, and people quote unquote call them crazy.
Hmm.
However, I do want to let the listener and viewer know that you are not crazy for going to therapy. It is your decision, and I believe in it 100%. And if you want to go either route, whether Will here has done the medication route, I've gone through the therapy route. Many people go through different routes onto what they believe, but never allow someone to make you feel like that you could you're viewed in a different way because you go to a therapist. Because there's many people who do, and there's many people who come back and say that they're doing 10 times better than they were.
There's
And
so many
Yeah.
different types of therapists. Like it
exactly.
doesn't mean anything.
And so remember, not only that you are not crazy, you are just a person going through different chemical imbalances. And if you believe that medication could be a route for you, we definitely find that talking to your doctor or listening to our podcast can not only give you the information that you need to make your decision, but hopefully in the end that the decision you do make is the right one for you. And don't worry about going with medication and then switching to a therapist, because I've seen a lot of that too. Medication tried, didn't work. And I've also seen people go therapy, didn't work, and go to medication. There's two routes in front of you. Definitely figure out which one's right for you, and we'll go from there.
Yeah, and even with CBT, like we didn't directly address it on like the last episode of bouncing back, but we talked about it. It's basically what it is, changing your negatives to positives. And I've seen a lot of people, even people here who didn't go the medication route, who use that. Like you don't even necessarily need to see a therapist to get the benefits of those things. So you can also do personal research. But just like Sina said, like listening to our podcast, getting good information from any sources that you can find. That's like where it really just starts. As long as you just start it, you'll figure out on your own what you think, and then that's where you can begin to try things.
So the next question is, are there any alternative paths that you've been seeing that have worked for patients regarding their feelings of depression, anxiety, or whatever they're dealing with?
Absolutely, cognitive behavioral therapy, right? So checking in, seeing a professional, mental health professional, regularly and frequently. Checking in with somebody once a week, and really diving into the behaviors and the cognition that leads to those type of outcomes, which is, for example, like depression and anxiety, and really deconstructing those behaviors and implementing new behaviors that have more positive outcomes. So cognitive behavioral therapy is a great alternative. I've actually seen studies that have shown where you use SSRIs alone compared to CBT alone, and both of them are equivocal. They both create an improvement in symptoms compared to placebo at the same amount. Now, if you adjunct them together, the effect is synergistic. So they even have a greater effect when added together, but even individually, they're equal to one another.
So like Dr. Tadayyon mentioned, as it's equivalent with CBT, medication can be used as both. It's whatever, again, you feel comfortable with. Figuring out what you personally need in your life. And the only person who knows you the best is you. So maybe it's time to take that step of whether maybe I do need to go speak to a doctor, or maybe I do need to go see a therapist. And so now it's just honestly figuring out how you feel about yourself, being self-aware, and just figuring out how you can help yourself. And what we try to focus here on YNA is not only to help you get the information that you need, but speak to professionals who can actually give you even more information about what direction might help you, the listener and viewer, to get to the place that you want to be in your life and truly to live your best life. And I think that's what we're all trying to do, right? We're all just trying to live our best
we're all
life.
trying to be happy, trying to live life the way we want to.
Just want to be me, man.
Yeah, exactly, right? I just
Yeah.
want to be me. And so we'll go on to the next question.
So the next question we asked Dr. Armin is that we think one thing that a lot of people have a difficulty understanding in the medical field is the relationship between anxiety and depression. So for you as a doctor, how do you diagnose it differently? How do people understand, and how do you identify the difference between if they have depression or if they have anxiety?
Yeah, right. So depression has its specific diagnostic features, right? So the one that we learn in medical school is CAPS, right? So it's excessive sadness, daytime, sleepiness, insomnia, appetite changes, weight changes, sleep pattern changes, inability to find joy in something that you found pleasurable before. That is the main cornerstones of depression, right? So, and to be diagnosed with major depressive episode, you have to participate. You have to have this for about 2 weeks straight. So 2 weeks straight of this type of behaviors would lead to a major depressive episode or major depressive diagnosis. So the DSM-5 is the Bible of psychiatry and psychology. It is the diagnostic manual for which diagnoses can be made. So, like for example, let's say you go to a psychiatrist and you say, how does a psychiatrist determine if you're depressed or if you're sad? You know what I mean? So depression is like a long-term sadness is something that you just feel like, I don't know, I didn't get the job, I'm sad, right? That doesn't mean I'm depressed. So how does a psychiatrist determine to put the diagnosis of depression on you? Well, the way that psychiatrist does it is by using the DSM-5. I would highly recommend looking into that. It's super important. Like for example, like PTSD, right? How are you diagnosed with PTSD? Per the DSM-5, you need to have experienced or witnessed a traumatic event, and traumatic is defined as where one's life could have been ended, or it was very fatal to one's life, and you have reoccurring memories or episodes of this event after 30 days. So that's PTSD. Now, let's say I got in, I remember, I don't know, when I was like early 20s, I back-ended somebody by a red light. And I mean, nothing really happened. It was just a fender bender. But for like 2 weeks, I just whenever I would go to stop at a back red light, I'd kind of tense up a little bit and just be reminded that me slamming in the back of this lady's car at 30 miles an hour, right?
Right.
So that was less than 30 days. That's called acute stress disorder. So somebody has acute stress disorder, and if it persists after 30 days, then it's PTSD. These are things that the DSM-5 make or create the diagnostic criteria.
To give the listener and viewer again a little bit more info about what the DSM-5 is. DSM is the book that psychologists, therapists, and psychiatrists, they use this book to pretty much diagnose you with whatever you're going through. So if it's depression, they go through a kind of like a checklist to see if whether you have these certain effects that the DSM-5 says that you do for people who have depression. Just quick little info for you guys. What I have to say to trying to understand depression and anxiety, one way that I know that I'm feeling pretty depressed is I have issues with my anger, and I get annoyed extremely easily by the littlest of things. And I know that if I'm continuing down that path for several days, that my depression, that I'm feeling depressed towards something, and something's kind of anchoring me down to the ground or drowning me. And with depression, I know you have more of the side of anxiety and the feeling of medication with the anxiety. When you were taking the medication, did depression and anxiety start to go away, or did it feel as if the medication was only focused on anxiety and you still felt depressed in certain times?
Yeah, so my initial diagnosis, however many years ago, 3, 4 years ago maybe, was a little bit of depression, but more anxiety than depression, and that's just how it was. So there's medications that I guess help both, and so I would take one pill to relieve both, or that's what we tried. For me, none of those worked at all. It took a lot of figuring it out, and it was more of deciphering okay, what feelings are related to this little bit of depression, and what feelings in your head are related to this uptake in anxiety. And so eventually it kind of got split down the middle. We figured out where went where, and I got anxiety medicine and I got depression medicine. And so the anxiety medicine itself took a long time to find, but it really helped, and it turned out in the end that I didn't really need depression medication, and so I was off of that. But those medicines can also the struggle with figuring out what the right medicine is they can counteract each other.
Right.
They can also like say like, hey, this medicine really helps my anxiety, but damn, like now I'm feeling more depressed. And then you'd stop the medicine to try to find something new, and you realize, okay, yeah, it was just the medicine. Let's try something else. But yeah, there's distinctive medicine to say like, okay, we're just gonna give you this for anxiety, we're gonna give you this for depression, we're gonna give you this for this for this, or like it can also be grouped into one thing depending on like how you're feeling.
And let me give you the view of on what happened in my therapy sessions. So I don't have much anxiety. I have more depression, and so we use tools that are focused on helping anxiety. That didn't really work for me, but when we use tools for certain depressive states and mental moments or episodes, they helped a lot more. And so you can find you lean sometimes on one side, you have more depression than you do have anxiety, or you can lean more on the side of you have more anxiety than you do have depression. And with medication and with therapy, you can find out which side you lean on more and figuring out what will work best for you. So the next question that we asked Dr. Tadayyon is, can medication be prescribed for both anxiety and depression at the same time? Is it two separate prescriptions for both of them, or can you be just given one?
Absolutely. So actually, anxiety and depression, the treatment of anxiety and depression is the same. So, for example, usually they come in pairs, right? So, everything, you got to remember, everything's on a spectrum. We have like Venn diagrams, and these Venn diagrams are these overlapping, ovals. You can't fully say like I have this. Very rarely you could say I have this, but I don't have any other things. Usually, psychiatric disorders or mental illnesses do come in, a variety of things. Depression and anxiety is a major common one, and the treatment options for depression and anxiety is exactly the same. So, giving SSRIs, selective serotonin reuptake inhibitors, which are called antidepressants, are also first line for anxiety treatment, and they're also called anxiolytics. Now it goes, so anxiety comes in many different flavors, right? So in depression, we have depression, and we have major depressive disorder, right? So depression and then major depressive disorder. And anxiety, there's a multiple variations of anxiety. For example, there's social anxiety disorder, generalized anxiety disorder, panic disorder, which is which is a subcategory of anxiety. So all of those, mostly when we're referring to generalized anxiety disorder, the treatment's going to be the same as for depression. That's going to be antidepressants or anxiolytics, such as SSRIs or SNRIs. Now, when you get to more severe, where you have like panic attacks, the medications utilized at treating panic attacks or at aborting those panic episodes. So if you feel yourself, for example, getting a panic attack coming on, you reach for this certain medication, and that medication is going to kick in very quickly and abort that panic attack that you would have had. Versus like anxiety medications where you have to take them for at least like 2 weeks for the levels to get therapeutic in your body.
So as he explained, we kind of go into the detail of the spectrum, which is really important. So Brandon, sometimes when we are at a level of trying to understand our depression and anxiety, we have different subcategories of depression and anxiety as we go down the list. Sometimes we have social anxiety, sometimes we have panic attacks, sometimes we have major depressive disorders, sometimes we have depressive disorders that are in different levels and situations. Have you ever felt as if you've had maybe social anxiety or depression and it's felt like it's on a spectrum where the anxiety is taking over and giving you more of a panic attack rather than the depression leading you into the panic attack?
So for me personally, social anxiety is the one that usually gets me the most. For an example, like for me personally, like when it comes to big social settings, I tend to get a little too over ahead of myself. I just find it hard to talk in big settings for some reason. Personally, me, I just feel like, what do you call it? Like kind of like out of the circle, if that makes sense. And I'll try to explain a little bit more. So basically, like when people are talking things like that, like I'll be trying to relay or trying to think of how to continue the conversation, but most of the time I just don't know how to do it. and it's just that, and it gets to my head over time. So basically, like when people ask me things at social stuff like that, I tend to just like, I call like a blackout, so I kind of space out a lot, and then from there, like my anxiety starts catching up to me, so I have to think of something off of the fly, and then half the time it's something that doesn't even correlate what is going on. So then from there, I kind of just like take myself out of the circle, and I just kind of go do my own thing. Or like when it starts bringing up the anxiety onto me, like I just either go outside and just try to like work on it or how to calm myself down. But over time, I've managed to work on that little by little, so I don't have those experiences anymore. So usually, like what I do to help with those experiences is just that I just kind of just stick myself out there, just in the blue, and just try to conversate, try to just work on like my social skills, things like that. I know a lot of people out there have problem with social skills, and honestly that's okay. We all been through there, we all gone through that. But the best way, how I personally, to me, is to fix that is just keep on talking, no matter like if people say like, oh, like I sound dumb or stupid, because that's how I personally feel at times a lot. I just ignore those in my head and just keep on continuing, just try to conversate, just keep on continuing, just to work with people, just talk to people, then eventually it will come natural to you. So that's kind of the best how I could kind of explain it.
Yeah, and I totally think that in situations when we're in a group setting, especially when you don't know a single person, you start to
Mm-hmm.
overthink, and you're like, "Well, I
Yeah.
don't want to be that loner in the corner, not talking to anybody."
That guy.
That
Yeah.
guy, yeah, you don't want to be
Yeah.
that guy. So it's definitely something that I think a lot of people will start to understand about how to deal with their social anxiety. So the next question that we asked Dr. Tadayyon is, why doesn't medication work for everyone, and how do you distinguish that from someone who may be abusing the medication?
Great question. So, first, let's attack the first question. So, why doesn't the medications work for everybody? So, the answer to that is monoamine oxidase theory. So, monoamine oxidase theory states that depression and anxiety really are the result of of imbalance of neurotransmitters in your brain. So there were many studies where they took a bunch of individuals and they looked at the relative amounts of neurotransmitters throughout their brain. And these major neurotransmitters include like serotonin, norepinephrine, dopamine. And they looked at a lot of these. And what they found is that people with depression, a lot of them had low amounts of serotonin. So that's where the antidepressants SSRIs come in, the selective serotonin reuptake inhibitors. These medications are pointed at increasing the amount of serotonin in your brain. So that works for some. But then what they also found out was that people who were diagnosed with depression had fine normal levels of serotonin, but their norepinephrine was down. So serotonin was okay, dopamine was okay, but norepinephrine was down. So these individuals wouldn't benefit from SSRIs, which increase serotonin. These individuals would benefit from a type of medication called SNRIs, selective norepinephrine reuptake inhibitors. So if you give somebody that has an SSRI, who has a low amounts of norepinephrine, and you give them an SSRI, it's not going to help. But if you give somebody who has low amounts of norepinephrine and you give them a drug that is aimed at increasing amounts of norepinephrine, that is that will be helpful. Now, monoamine oxidase theory isn't that clear either because it shows relative differences. For example, someone might have low serotonin, another person might have low norepinephrine, but another person might have low serotonin and low norepinephrine. So, it really depends. It really depends per the individual. It has been proven that mental illnesses change the way that your brain work. For example, like depression will rewire your brain. PTSD, my research after that I spent several years researching on was the way that PTSD alters neural connectivity in combat veterans returning from Iraq and Afghanistan. What I discovered was that having the diagnosis of PTSD physically altered the way that different parts of the brain communicated with each other.
Wow.
Yeah, so it's not just a perception, right? So having depression, having anxiety, having PTSD is really like a pathological. It's really something that is an imbalance in your brain. It's not just the way that you change. You feel like, oh, I just need to get happier, right? I just need to do this. No, there really is a science behind it, and the level of neurotransmitters and the way that your brain's communicating with different parts of your brain is altered. So these medications, there's a whole way of approaching of how to treat these things, these different ways, and we have to find that. Well, but the hard part is really understanding, what's wrong with this particular individual's pathology, right, or physiology, and then finding the treatment that is best geared towards fixing that problem, right? So if I give a Phillips screwdriver for a flathead, it's not going to help.
So I think this is the most beautiful part about being human, is that we all have our own crazy chemical imbalances in our brains. Some people feel more depressed, some people feel more anxiety, some people feel have different levels of serotonin to the epinephrine. And what I want to tell you is that it's okay to not be okay, like you thinking that you need to be happier or you need to feel this way or feel that way. It's truly a chemical imbalance in your brain. It's something that has a physical toll in your mind that you sometimes don't even have full control of. So when you are going through depressive episodes and anxious episodes, that these things are not, it's not like they're supposed to be normal and that we all have this and we all have that. No, it's your brain going through its levels of rewiring that it knows how to protect itself or how to feel, or maybe not how it's supposed to feel. So don't think that, hey, I'm feeling depressed today because of this or that. It truly could be just a chemical imbalance of where you woke up in the morning, right, Cheyenne? Like,
Yeah, like I mean, I think it definitely like clears up the stigma that a lot of people have, where mental illnesses and depression and anxiety, they're all just kind of like in your head, like
You just get
not
better,
yeah,
man.
yeah,
like it's mostly just biochemistry, and sometimes we can't help it, and so everything that he's saying is like these are the things that people use to actually help like their chemical imbalances in their head, to help with the depression, to help with the anxiety, you
In
know?
that case, there's no other way to do it.
Yeah.
Like you need to get that help.
yeah. And so that's something that we are really glad for you, the listener and viewer, to understand. And we'll get on to the next question.
So the next thing we asked was, during the rewiring of the brain, certain mental illnesses can really change how you think, how you feel, changing several emotions and how you address people. It seems like as you go through life with different mental illnesses, the brain rewires itself. Does the medication help the rewiring? Can you go back to what and who you were before the mental illness?
So if you're diagnosed with depression, right? So the rewiring in your brain has changed. So the goal of medications, and it doesn't necessarily just have to be medication. It's also cognitive behavioral therapy, right? Cognitive behavioral therapy looks at the way that your thoughts and behaviors are associated with each other, and then what it looks to do is to disconnect those behaviors without the use of medications. So both ways look at the way of rewiring your brain back to more of what it was prior to this illnesses develop. But remember, these illnesses developing isn't like a flip of a switch, right? Like it's not like, today you're normal, tomorrow you're abnormal. It's consistently just driving away over a significant period of time that eventually leads you down this path. And you're like, oh my God, how did I end up here? Right. So these medications aim and cognitive behavioral therapy aims at going back to normal physiology levels of specifically like neurotransmitters and rewiring your brain to be more connected to the areas which it used to be. Now, how do people abuse their medications? Well, it really depends on what medications you're referring to. So, for example, antidepressants such as SSRIs and SNRIs, it's very difficult to abuse those. Anything that I've seen within the medical field of SSRIs and SNRIs being taken extensively were due to individuals attempting to end their own life. They've taken a lot of, it was a suicide attempt. They wanted to overdose on drugs. So they reach for their antidepressants or medications. Fortunately, these medications, we can be countered in the emergency setting, but these medications aren't ones that normally typically get abused. Medications that typically get abused are medications that create instant relief, or they create euphoric effects. And individuals begin associating the use of this medication to a relief from their previous state. And if I take more, then I'll have more of a greater relief than my previous state. So one example of medications that can get abused is anxiolytics. So for example, panic disorder, when you start having a panic attack, you reach for some type of anxiolytic. Sometimes this commonly is something like a benzodiazepine that you take that its onset is literally minutes, and it will suppress any type of anxious drive and really calm you almost immediately. So this is a quick, gratification relief that you get from this medication. So people see that as a way of, hey, if this provided me with some relief, maybe if I take more, I won't ever have this again. Or maybe if I take more, this is the only way that I see what normal looks like. So that it's kind of like habit forming. You know what I mean? It begins this habit where, this helped me before. So one helped me before. So maybe two will help me even more. Or maybe three will even help me even more. Or maybe I have to be in this state to just not even feel like that anymore. And that's how addiction gets to be created.
So where he expresses the thoughts of rewiring is extremely important, because as our brain goes through different phases of life and scenarios, your brain continuously rewires itself to make sure that it continuously find, whether it's new information, whether it's new scenarios, whether it's new experiences, whether it's something, it just continuously goes into this motion of rewiring. And when you go through these depressive episodes and panic attacks, your brain rewires itself to make sure that it's prepared for different situations, and also it tries to understand and help to really figure out what's going on. Will, did you feel any rewiring during your process of taking the medication?
Yeah, I mean, me personally, I was on like panic attack type anxiety medication, and so I can really see why, and I can understand why that it can be taken very abusively. At the time, like, it all kind of goes full circle. At the time, um, like yeah, as a kid, like you're not given like something as severe as Xanax, right? But you're still
Right.
given some type of like something Zapine, like that's usually the what people look for when they're treating anxiety. Something I don't know, I just don't know what those medications specifically are called, but it's just meant to calm you down, stop your thoughts process. Pretty much, it's just blunt. It's meant to sedate you basically, and that's fine. It doesn't last like the entire day, right? It's just when you're having this onset of a panic attack. You would take it, or I would take it. It would 5 minutes and it's fine. Like it really helps. And there were times where like they say, okay, like over time, if you were taking something like that every other day, to which I was, the medication doesn't necessarily stop working, but the effect, like the first time you take a medication like that, it really hits you. Like you know it's working, you know for sure it's working, and not that you get used to those effects, or it's either you get used to it, or like he said, the effects kind of like come down because you're still taking the same dose. As you keep taking something, you need to up the dose to feel the same effects. It's kind of like that first people say about the first high, like you're always chasing that first high
Right.
that people deal with. And there were times where, okay, like to my therapist, if the panic attack was bad enough, take two of those, but really try not to do it. And there were only maybe like one or two instances where I ever had to do that. But when I did have to do that, I can definitely see why those are taken abusively and why they're prone to do it, because you feel really good. It really helps. It doesn't just like blunt your feelings, but it adds more dopamine and serotonin into your brain, and it's that high feeling that I assume people are chasing.
It's the euphoric effect is what
Yeah.
I keep coming back to. What I think is the biggest issue when it does come to those kind of medications that have those kind of effects to help you. They need to go through the euphoric effect. That euphoric effect helps you feel a lot better, but also the euphoric effect is what you started chasing and where the addiction slowly goes, where it slowly starts beginning. And we're going to start getting more into the addiction side of the episode as we slowly enter into the next couple questions. So we're going to jump into the next one. Why does the human brain tell us, what if I just take more, I just keep taking more, and then I'll just feel better?
Great question. And I think the answer to that question is honestly is that the human brain itself, think of it as very fertile soil. You have farmland and the soil is so fertile. It wants to grow whatever you put into it. All it wants to do is give back what you put into it. It doesn't care what you put into it. It doesn't care if you put in negative thoughts, positive thoughts, etc. It's just going to give back what you put into it. So in a big fertile soil, if I plant a bunch of poison and weeds and bunch of just really bad plants, that fertile soil is going to give me more of this shrub, of this poison, of these really, like poison ivy and these really bad shrubs. It doesn't care what I put into it. It's just going to give me back whatever I put into it. On the other hand, if I put into it, I take care of the land. I focus on putting in roses and daisies and etc. And I feed it these things. It's gonna give me back those things. The human mind itself is not smart. The way that I like to think about it, the human mind itself is just something that wants to thrive, and it will give back whatever you put into it. So, I mean, think about this. Have you ever heard, day by day, I get better and better in every single way. Imagine like thinking to yourself, oh, today I did this. I'm so grateful. Just find three things, like you just hear from these self-help books. Just find three things that you find really grateful. Well, what are they trying to do? They're trying to just feed this fertile soil, just some little grateful things for it to give back more grateful things, to create these habits so that you're consistently focusing on the positive and your mind is constantly giving you back that positive. Now, on the other hand, let's say you get home from work, like, oh my God, I was so stupid. I can't believe I said that. Or I can't believe I did that. Oh, I can't believe, I didn't do this. Oh gosh, I'm so dumb. I don't deserve this. And you keep saying that to yourself. All you're giving to that fertile land is just that negativity. And that fertile land is just going to give you back that negativity.
I think this part of the episode I want to really dive deep into to help you guys understand what the soil in your mind is like. I think you do need to look at your brain as kind of a farmland because, again, and we've said it, I believe plenty of times on
We always
our
talk about it.
podcast,
Yeah.
negativity, positivity, planting the right seeds in your mind. But I want you to understand, again, sometimes we do go through experiences that we don't understand when we're putting in a poisonous shrub, or we don't know when we're putting something in that's going to give us more negative effects than positive effects until we get hit by the negative effects and then we decide this plant needs to go. So, let me ask you guys this. How do I take care of my soil? How do I know to plant the right seeds? And when it's time to take those, time to remove a plant or a seed, what can I do or what can I figure out to not only help my mental health, but also maybe help other people around me to see if they can plant the right plants?
I think it's just all about putting yourself in the right environment and seeking professional helps or whatever you're comfortable with. I mean, we all need help, and sometimes we all need to take a step back from our life and really look at it in kind of like a bigger picture, like grand scheme of things. Because you can't really see this whole field of view when you're watching it like right here. And like that's how it feels most of the time when we're dealing with these issues, like the anxiety, the depression. It's just like up front, right in our faces. When really, if we take a step back, yeah, we have the input from other people and from professionals, from things we see living life in general, and it just all kind of correlates with each other and just helps us achieve that.
Yeah. And how Cheyenne was just describing, again, when it's in your face, when depression and anxiety is just beating you and punching you in the face, the soil is it's gonna get harder to plant the right positive seeds that you need, right? When you're feeling depressed and when you're feeling sad and when you're feeling anxious, it's hard to be like, yes, if I tell myself I'm going to be okay, everything will be okay. Yes, if I say the right things to myself, I'll be okay. I've been in extremely depressive episodes, and maybe you can touch a little bit about the anxious episodes, but when I'm in my depressive episodes and I try to tell myself, yeah, I'll be okay. Yeah, this happens. It doesn't help. I feel as if it makes it a lot worse, and I just keep spiraling and it doesn't help. So I think the thing that I have to say when you're when you're in front of depression, depression is staring you right in the face. When depression's punching you in the face, it's hard to be aware of that situation because sometimes I'm blinded that I'm not sure if I'm really feeling depressed or maybe my emotions and my chemical imbalance are just not correct right now. I don't know. But I think what I keep going back to and what a core thing that I am trying to understand is everybody goes through these things. Everybody has these situations. Everybody has an episode. Maybe not as extremes as me, or maybe not as difficult as I do, but when I go through these depressive episodes, I need to remind myself not only am I not the only person who's going through this, but this is something that will pass. I can't stay depressed forever. I can't be anxious forever. I can't be sad all the time. I know at one point things will look up. And again, I think it goes back to our bouncing back episode. When you fall and you hit rock bottom, trying to get back up and climb the stairs of an incline is much harder than when it was falling. But if you keep reminding yourself the little things about the little seeds, I guess, that we like to plant in our soil, right? The little things that to remind ourselves when the rain is coming and when it's not sunny at all, that this cloud will pass. So I think if you've got anything to say about your anxious episode and how you helped yourself in your periods of life, please feel free to share.
Yeah, just real quick. Like, I mean, it's tough to say. Like, for me personally, it seems like, and even with other people that I see, it's more, I feel like sometimes you just add these negative plants to your field accidentally. Like, you don't realize you're doing it until it's in your, like, until it's grown, it's in your face, and then you can help identify a problem. But kind of like how I think about it like this is like maybe like I don't know, like you're in high school, you missed the bus, and now like oh your mom's gonna be pissed that she's got to drive you to school now. But like,
Yeah.
damn, now your day is like already in the shitter, and now you're gonna go the rest of your day, and all you're gonna see, like you're gonna get in that mindset, and you're gonna notice how easy it is to see more negative things throughout that day. And sometimes it's just on a daily basis, but like grow that to like existential crises and big life problems that like you don't necessarily like. You have to go through those things, and you will find your own way to go through it. But if you might not mean to take the negative side of those things, you just accidentally do it or accidentally think it or accidentally say something to yourself, and from there it'll grow and you will start realizing that more and more. And to me it was just more of a process of in the beginning how to distinguish those problems at the very beginning so that I could better change my thoughts right as it's starting. So that way that seed doesn't even sprout. I'm going to spray it with some damn weed killer. It doesn't even grow. It's already out of the ground before it starts. And that, I think that what I'm trying to say is being able to change those negative thoughts positively before those negative thoughts can sprout any further. Like just addressing it as fast as you can, whether you need to go talk to somebody or you're able to figure it out for yourself. It's just being able to address those problems as quickly as possible.
And when you plant bad seeds plenty of times, you start seeing the little hints of when it's a bad seed before it fully grows into the plant it is itself.
Yeah, you do
Sometimes
get
you'll get
used to
hints.
it. You get
You,
used to it.
yeah,
Oh yeah.
and you figure out what's good for you, and you figure out what plants are right for you, and what seeds to plant, and what seeds to uproot. And that's something that we here at YNA are glad to share with you guys. And we're gonna jump into the next question. What are signs that someone is abusing medication, and what happens when you take medication that isn't prescribed for you?
Yeah, so what are signs that people are abusing medications? So signs that people are abusing medications, for example. So let's say somebody's using benzodiazepines to abort their panic disorders. and they're only prescribed one per day. What are signs that they're abusing? One, they're running out of the prescription earlier than their refill date, or they're going to their doctor and they're saying, "Hey, I know you gave me 5 milligrams before, but it's not really doing its job anymore, and I need 10." Now the doctor ups it to 10, and then they come back a month later. "Hey, 10's not doing the job. We got to up it some more," and it's this constant drive for more and more dosages. Now, like for example, and benzodiazepines have very high abuse potential, so these are more controlled substances. Another controlled substances that we use for mental illnesses or as pharmacological methods are, for example, for ADD and ADHD. We provide Adderall, or which is methamphetamine. We provide Ritalin, which is derivatives of methamphetamines. These also have very high abuse potentials, and people can be coming in like, "Hey, doctor, I'm having difficulty, concentrating, constantly being, interrupted. I can't finish my work," and they get prescribed. They get the diagnosis of ADD or ADHD. They're prescribed Adderall, and then next week or 2 weeks later, they come back, "Hey, this isn't doing much. I need more, or I need to up my dosage." You're constantly like changing medications or changing the dosages or upping the dosages are signs that somebody is abusing their medications.
So when it comes to abusing medication, it seems like the most important effect that we keep coming back to, and the core thing is the euphoric effect. We realize that in places where we do abuse medication, we are always chasing that one high. We're always chasing how we feel. It seems like it becomes difficult these days to truly understand why we abuse medication, but it starts with you. It's when we start abusing medication is when self-awareness disappears. You stop trying to understand how much medication you're taking, but instead you're chasing the feeling of feeling better. And so addiction plays a really big part of this because it slowly leads itself into the feeling of not only losing self-awareness, but focusing so much on that euphoric effect. Will, was there a time where you felt as if there was any way that you could stop yourself from taking the medication because you knew that maybe you were getting addicted to it, or was there no signs of that and you just knew from being self-aware and how you were feeling that the medication was starting to over not fix the problem, but you were not chasing the euphoric effect anymore?
No signs of it. No, I'm just kidding. It's really hard to say. Like with depression medication, you usually get to the feeling of like you are trying to suppress these feelings, and then with I'm more on the anxiety side, which I'm more familiar with. It's more of like you would get those people chasing the euphoric effects. With depression, you're kind of hiding the feelings. With anxiety, you're kind of giving an extra sense of like happiness, or you're trying to like be happy, and so that's where those euphoric effects come from. For me, like finding the right medication, and I dealt with both, is finding like that middle ground. Even now I'm only taking anxiety medication, you still have to find out, hey, like, is this altering my way of thinking, as depression medication did. And there was a lot of medications that I took on both sides that would I would be like a walking zombie. I wouldn't, like I said, these when you go back to visit, it usually takes a couple weeks before it gets in your system, and then you got another couple weeks on it, and then you go see them and you talk about, hey, how does this make you feel? You decide you want to continue, take a new medication. But there are those medications that really do essentially suppress that emotion on the depression side, and those are medications I didn't like. And there were times where I kept taking, because they do help, they were helping, but they were not allowing me to be self-aware. They were not allowing me to not necessarily have thoughts of my own, but address the core problem. I talked about the onion example from, I think, meditation. When you're able to find the core problem, you're able to better find a solution for yourself that maybe doesn't even require medicine. Medication can help, of course, but you need to find that medication that won't suppress or increase that euphoric effect that essentially will lead you to addiction. And with most people, like, I don't even think personally that people are chasing like the high. It's more of like they don't go into it to chase the high. They go into it for help, and then they feel this and they say, wow, this is what feeling good feels like. I have not felt this way in a long time. And that's where maybe addiction begins, but they don't realize it.
Right.
That's what I can say on that.
And as we move into the next question, we really try to understand not only what addiction is, but how it can get started. And so the next question for Dr. Tadayyon is addiction hereditary? Can I get it from a family who also suffers from addiction?
Yeah, that's a great question. So the question there is addiction hereditary, and this comes nature versus nurture, right? So what is it genetic or is it environmental? I don't know the answer to that one. Imagine yourself, for example, being very young and you see your parents as young children do, as very heroic figures or as figures of authority where you derive your principles and your ethics from. Now, if you see these individuals, being addicted to something or being, you see that sense of control as like their happiness is derived from one particular item or one particular, by doing this habit or, by drinking, for example, they derived happiness from drinking or they derived happiness from abusing their prescription medications. Maybe, and you see them as, this is where you're deriving your principles and your ethics and your values from as a kid. These things can be easily engraved into you. So that's the idea of nurture, right? It's environmental, not really genetic. On the other hand, it is possible to have genes that can make you more susceptible to addiction compared to somebody else, right? Maybe somebody else would require a little bit more relief from that pain in order for their brain to be like, hey, let's try this again. Or, hey, maybe if we take 2 this time, we'll have more relief versus somebody who just had relief once. Maybe they don't, genetically, they're wired to go down that route much quicker.
So, like you were saying, Will, relief plays the most important part, right? Like you keep taking that one to keep feeling better, and then you start feeling the normal feelings of feeling like you have everything figured out, and that the mental illness is not there anymore.
Yeah, especially for those people who've gone through it for so long.
Right. And Brandon, I gotta ask you, is there been any situations that you know of or that you can understand where addiction can be either environmental, where it is nature versus nurture, where the feelings of what you're surrounded with play an important part, or is it more, do you think, the focus of genes, where I can feel more addicted to it because my grandfather or my great great grandfather had this illness of addiction, and they were always addicted to something that they kept doing?
I feel it has to do with environmental reasoning behind that because I feel like influence also could play a factor into that. So, for an example, let's say if a young kid, like sees like his parents, either they're doing something bad, whether it's like they're taking drugs or they're taking pills all the time, so they see that throughout their entire life, and they start having these little things go on through their head, like wondering like what mom and dad is taking, things like that. So I feel like that could play a factor, and also that to influence as well. So depending what your environment is at, people are more prone to either take the substance or not, depending where you're at. So, and I know like out there, like in poorer communities, people are more likely to take a substance or even get addicted to the substance because they don't have a way to either get out or try to escape some sort of feeling that they're having that they don't like. So they'll lean onto that. You know what I'm saying? So I just feel like environment plays a big factor. Genetic wise, to be honest, I'm not too sure. I mean, it could possibly be genetics as well, but mostly what I've seen, environment plays a big factor into addiction.
Especially when you're young, especially when you're starting off and you're just trying to learn about life and trying to understand. And like Dr. Tadayyon said, where we look at our family as heroic figures, but when we see our family go down difficult paths with alcoholic abuse and drug abuse, and we see that in front of our face, we kind of lose that feeling of being there with the family and losing that heroic effect of who they are. So I truly believe that environmental plays a part. But I also can agree with the point that genetics can seem to be a part of getting addicted to things. But again, I think it all starts with being self aware, and you can beat addiction, but it's going to take time. It's not something that you're going to be able to beat like right away. everything takes time. It takes practice. It takes a lot of understanding your mental health. It's a lot of understanding who you are and figuring out what things you do get addicted to. I have friends who are dealing with beating alcohol that and being around friends who are partying and who have difficult time just being around those kind of people makes it harder for them not to just go back into drinking again and being addicted again. So it's also maybe sometimes who you surround yourself with. Those people who, if you go and tell them like, "Hey, I'm dealing with alcohol abuse. I need you guys to help me. If we're around, please don't offer me a drink or be in those kind of situations." It becomes difficult too, right? Um, so as we play a big part of understanding what our friends and family can do, it kind of leads into the next question. And what we asked Dr. Tadayyon was, what are things I can ask friends or family to see if they're abusing medication? What are signs to look out for when things that are not of nature can occur?
Yeah, so I think, I don't you gotta first, in order to find out if somebody is abusing, or you're concerned about someone, right? And you're concerned that somebody might be abusing their meds, or they might be, going down a path that might not be the best path. How do you approach that? How do you bring that conversation? Well, I don't think, me personally, I think the way to approach it is to look at the individual and look at what's most important for them and address the topic that what they think is the problem is. Sometimes, for example, it's difficult to be like, hey, you're taking these I see you, acting weird. I see you that you're running out of your prescriptions quickly. I see you upping your dosages. You can approach it that way. It really, but it also, could be like, hey, I've noticed you're not as happy as you used to be, or hey, I've noticed that you haven't gone, played basketball like you used to play basketball. What's going on? And maybe we can go play basketball again, or maybe we could go do this. It's really building that rapport with the individual, and building that rapport with the individual where you feel like they can confide in you, and they trust you, and they know that you have their best interests at heart. It's different for different people, right? Some people need tough love, right? Sometimes you need to show them tough love. Other people, tough love is just gonna squish them, right? It's not what they need. It's not what they want. Maybe they just need connection. Maybe they just need support. Maybe they just need somebody to listen, or maybe somebody just feels a little bit closed off and they just need space. But just reaching out and saying, hey, I've noticed if you need somebody to talk to, I just want you to know that I'm here, and go and approaching it always in a very non-judgmental way. Remember, we're all wearing glasses looking through our world through our particular lenses and filters, right? This is the way that we see the world, and the way that we see the world may not be the way that the other person is seeing the world. So we have to be willing to take off our glasses, begin to imagine what is their perception like, and then approach them in a way that best suits them, and that is non-judgmental, that is not non-confrontational, that is safe, supportive, and it builds rapport.
Shannon, I think when it comes to the conversation, it seems like it's really difficult sometimes for people just to even have that conversation. How do I even start that conversation? If I am abusing medication and you see me changing, what can you say to me? Like how do I talk to my friends about this?
Well, it's hard because I mean, as humans, like we want to be right about everything, and we want to know what to say, and we want to be able to give that advice. But a lot of the times, like our ego can get in the way of what we think is right and wrong, and a lot of the times, if especially if you don't know exactly what you need to say to your friend, like you need to drop that ego and maybe point them in the direction of a professional, especially when you kind of come at them like just wanting to fix their issues. You're not always going to be able to put yourself in their shoes. You need to be able to walk a mile in their shoes. And even if they are your best friend, your close friend, you're not always going to be able to grasp onto something that's relatable and give them the best advice for it. So a lot of the times like you really just need to be a good listener, and you need to be able to internalize, sit there and really process what they're saying to you, the pain that they're going through. If it's a addiction, you can kind of like send out feelers for them to latch onto a conversation with you. But when it comes to professional help, like you need to point them in the direction that is best for them, not what you think is the right thing to say in that moment in time.
I really loved how you said listen. And I feel like as humans these days, we feel like we lose one of the most important parts when we do get into a conversation where we don't have that connection. We don't understand what that person is going through. So we have to try to absorb whatever we can from the person that's describing how they're feeling. And the issue is we do just give our 2 cents way too
Yeah,
quickly.
exactly.
We just can't, when you don't know how to connect with someone and they're dealing with something that you've never dealt with, you kind of go down the road of I'm just going to throw them things that have helped me in other situations that might be able to help them. When the things that you're saying actually and throwing your 2 cents right away can actually hurt the person because you're not taking the time to absorb the information that they're giving you. And that is the issue that we have these days, is like we don't genuinely listen to people. And that's something that we really need to fix, is we need to genuinely listen to people and see what they're dealing with. Sometimes when I'm upset and I'm in a depressive episode, if I come to you and I start expressing how I feel, and then you jump right into fix mode, or here's what I did or what I can do, it kind of puts me off, like you don't understand what I'm actually going through, which is okay. But I need you sometimes just to listen to me, to listen to how I feel, to understand my emotion. Sometimes all you need to really do is go through the emotions with them. And truly, if I've had friends that have given me their 2 cents and it didn't help, but I've also had friends who sat there and just listened and genuinely understood what I'm going through, which helped me a lot more in the end. Is there anything that you think, Will, when we lose this genuosity of listening, what can we do to better connect with the people that we don't understand their feelings and put on the glasses that we need to actually understand who or what they're going through?
I feel like these situations usually happen when you're like face to face with the person, right? And that can make it harder because you also have to sit there and they kind of, I feel like, especially with me, like sometimes not act, I expect a response right away. And so like that puts pressure on the other person or on you if you're the person helping. There's also the situation of where, hey, maybe they're just texting you or they're calling you. And I know there are people who have talked to me and people that I've talked to and gotten help, and it's good to address something right away sometimes that I've found to help, and is that before you start getting into things, you say like, hey, okay, I understand what we're, maybe they start and you realize this is this type of situation. Right away, just address like, hey, what is this? Do you like what do you want from me? And it's okay to ask that. Like, do you want me to listen or do you want me to help you fix it? And
Right.
usually that other person, in my experience, is very open there. They might even say like, I don't know, and then you have to make a cautious decision to where I would say probably listen and sit with that information at first. But again, like Cheyenne said, you're not going to know the answer to everything, and there's going to come a point where you have to say like, you can say like, hey, maybe you should talk to this person, or hey, maybe you should get help from somebody. And that's okay to say, especially if they're I imagine if a situation like this, and in my experience, it's always a close friend or someone who has that trust in you to come talk to you in the first place. They are okay with any answer you give them for the most part, as long as you're putting yourself in their shoes and not just saying, oh, this is what you need to do, like get over it, as long as you're receptive.
Right. And being receptive is extremely important. Again, listen, I loved how you said ask them what you need help with. Sometimes all we need to do is just ask the right questions, or just actually just sit there and listen. And that person will tell you what they need help with. And if they say I don't know, I think that's a perfect time to go and explore with them the issues that are resulting and what you guys can do. Because, I mean, if it's your best friend, brother, sibling, whatever it is, the person that's coming to you actually trusts you a lot. I don't go and just start blabbing my problems out to anybody, especially my depressive episodes. I go to the people that mean to me and that I can trust them. So if someone's coming to you and describing what's going on in their life, they really trust you. and they need you at that time to just either listen, help them with whatever they need. So maybe sometimes ask the question of, what do you need me to do? And that's not a wrong question, and phrasing it in the right way can also help them. And as we go down this road, it kind of enters the next question that we're getting into, and this is the next question we asked Dr. Tadayyon. What advice can you give to someone who doesn't even know where to begin when it comes to substance abuse? How to get over the what if, and what is that mindset?
That's a great question, and Tina, I think it embodies the way that fear brings about, in my opinion, is isolation, right? Feeling that you're the only person in the world that is feeling this way, and if you go up to your doctor and you want to begin the conversation that, hey, I've been feeling a little bit depressed lately, or I've been feeling this way lately, that they might judge you, or that you're the only person who would ever think these things, or that you know. These things are so uncommon. It's only you, and you must be the only one or the only person. And I really think your podcast is really embodies this, that you're not alone, right? You're not the only person that's experiencing these things. You're not the only person that is feeling this way, that is afraid to talk to their doctor. You're not the only person that you know that feels scared. There's a whole group of individuals out there, and all feeling the same way as you. And the downside is that they've been siloed. Everyone's in their own little silo, and being in their own little silos, there's a lack of support and a lack of rapport, and that creates isolation and fear and negative thoughts. So as people, as listeners are considering, like, hey, I haven't been feeling myself. I've lost enjoyment in the things that I used to find joyful. Uh, what is it that how can I start this comment? How can I even consider that maybe I do have some depressive symptoms, or maybe I am going down a path that I really don't want to go down to? Is that you're not alone. You're not the only person there, and there are other people, including your doctors, and support systems that really care about you, and they don't want you to see you going down there. So taking that first step is courageous, and that's amazing, and we applaud that.
And we applaud you, the listener and viewer, for going through some difficult situations, some difficult times. But I have to ask you, gentlemen, how do I get out of this isolation that Dr. Tadayyon is mentioning? Because we feel as if we get stuck, and we feel as if the world's against us, and that it's only us that the world's gunning for, because we only see through our lenses. How do I get over this isolation?
I think one of the first steps of getting out of that isolation and being alone to our own thoughts is really just taking that brave step and just having a conversation with somebody, or just reaching out to your friends. And if you don't have any friends or anything, reach out to a professional who really knows what they're doing, because chances are they've dealt with a lot of people who have been in the exact same situation as you. And again, like, you don't want to go to the wrong person for very important very important advice when it comes to your mental health and your mental state of mind. You always want to surround yourself with the right people. Make sure that your environment is good for you, and basically, you just need to have the bravery to actually branch out and want to help yourself.
And what I need to say to you, the listener and viewer, is you are not alone. We all go through difficult situations. We all go through difficult times in life. We all go through difficult scenarios. Life is not easy. I can ask all three of these gentlemen right here, and I bet you they'll come back with the same answer, that life is not easy.
I don't even have an
No
answer.
way.
Same.
No, because we all go through our own complete different scenarios. We all go through different parts of life. Some people go through grief. Some people go through a breakup. Some people go through losing their friendship that they've had for a really long time. Some people end up with different mental disorders later on in life, whether it's PTSD, depression, anxiety. I could name them all off for you. However, what I do need to let you know is you are not alone. A lot of people go through these difficult situations. A lot of people go through these difficult scenarios, and not everyone has the answer. I don't have the answer to all of your mental health issues. I don't have the answer to fixing what's going on in your life.
Sometimes it takes years to find.
It truly does. It took me a long time to figure out my PTSD. It took me a long time to finally figure out how to fight it, how to get in the boxing ring every single day and throw a punch. What I want to do remind you is that people do go through the situations that you're going through. And I know it's tough. And I know it can be really, really, it could feel like it's just you. I get that. I've been there. I feel like when the world is just throwing all the shit on top of your head, feels like everything is just, nothing is working for you. That's when it gets hard to keep the mindset of just being like, I can do this. But that's what we're here for. We're here to help you. We're here to help motivate you. And we want to figure out what's going on so that we can figure out how we can help you live your best life. And that's what we're focused on. And that's what we here at You're Not Alone. And that's what we want to do. But please, please, please remember, you are not alone. People go through these things. And we've got you. And please don't forget to like, share, subscribe, comment on whatever you guys want us to talk about. Maybe you got some topics in your head that you think we should. We would love to hear it.
Even some quick questions.
Even some quick questions.
Doesn't matter.
It doesn't matter. We really appreciate Dr. Armin Tadayyon coming on here and explaining from the medical perspective of what medication can do.
And we'll put his information in the description if you want to reach out to him or just see who he is.
Yeah, and check him out. He's an incredible photographer. I have to say, don't forget, we're here for you. And we've got some amazing merch. It's very comfortable. We've got the awesome YNA t-shirts.
Comfortable.
We still got some sweatshirts left. We'll be bringing out new merch soon. You can check that out at www.sbsuit.com. And honestly, we can't wait to see you at the next episode.
Thank you for watching.
Thank you for watching.